Hello, I'm Dr. James Nill, Nill Family Chiropractic and Wellness Center, and today we're going to talk about foot pain. The majority of foot pain stems from having flat feet or low arches. A lot of times I see that with little kids all the way up to adults, and it could be congenital or it could be come on by walking on concrete too much, wear and tear, and whatnot. Eventually, if you have too many problems with the flat feet, you end up having a bunion formation, or you can have what's called plantar fasciitis, which is a fascial layer on the bottom of the foot that gets inflamed and it keeps getting stretched. So we're going to show you how we can treat the plantar fasciitis. The first thing we're going to do is what's called anodyne therapy. We're going to strap this, as shown right here, to the bottom of the feet. You can see these little lights right here. These are little diodes that release a certain wavelength of light, 890 nanometers to be exact, which causes the blood vessels and the hemoglobin in the blood vessels to release nitric oxide. That is a natural vasodilator. In other words, it opens up all the lymphatic and blood vessels, arteries and veins, and it helps drains out all the inflammation that's down there, and it makes the treatment go a lot easier. Now what we want to do next is actually come in here with this tool here. This is called gua sha therapy. What we're going to do is we're going to put some lotion on here. We're actually going to scrape in here. Now unfortunately, ticklish feet and painful feet, it's not a real fun process, but the results are absolutely outstanding. Of course, we come in here and we're going to come and then we're going to scrape down in this area, come up the side, just a little bit in here. You can see he's starting to tickle a little bit, and then we get back in here in the ankle area, and of course the origin insertion therapy to try to help stabilize that fascia in there. Of course, the underlying problem is more than likely flat feet, and that's where we do custom molded orthotics, which I'm going to talk about next. Now my main goal, of course, is try to find out what the main problem or cause of a person's dysfunction or symptoms are. So majority, I'd say at least 60 to 70% have dysfunction within the feet that causes a problem up above. And what I do is what's called sole supports custom molded foot orthosis. These are actually done in the office. I'm going to demonstrate you in a second here how we form the orthotics in here, and then we ship it out to a company and it comes back and you can actually see it's a different thickness of plastic and it has some give to it, but it's actually, we create an arch that's actually proper for your foot. And there's different kinds of sizes and different kinds of material we put on top. And these can actually go in from one shoe to the next. And of course you have your option of different colors here. Yeah. The first thing we want to do is what's called tailor neutral. And we want to make sure we have a 90-degree angle on everything here. And then we also want to make sure the foot is lined up with the femur. So what we're going to do is we're going to come over here. We're going to create the arch by coming up to the resistance. He's just going to let me do it. I bring that up, and I kind of come in here, push down, and then stabilize that. And then by coming around like this, knocking down foot, everything here, coming down like that, locking it in, bringing the foot out, and you can see we actually have a true arch. Sometimes people will find that both feet will be numb, tingly, or have pain in it. In the majority of the case, that's called neuropathy, which is a disruption within the nerve endings in the feet itself. And so what we want to do is increase circulation to that area, and that way it'll get more nutrients to those nerve endings, and that way the neuropathy will actually go away. So right now I'm going to demonstrate what I do to treat that. Okay, what we're going to do to treat it is called anodyne therapy, which is a patented device which actually has these pads here that releases light energy. Now the light therapy is 890 nanometers in wavelength, and what that does is it gets absorbed by the red blood cells, and in effect it releases nitric oxide from the hemoglobin, and what that does, it's a natural vasodilator. In a sense, it pretty much opens up all the blood vessels in the area and increases circulation to the foot. Now, if somebody has this problem, if they're going through the anodyne treatment program, which is 12 visits, 3 times a week for a month, you want to keep them close together. And it's also an ongoing research project to try to get Medicare to cover just this unit because it works so well, where it's an ongoing clinical study. So I'm going to put these pads on Evan. And then we're going to pull this around. And he may feel a little heat, so I'm going to periodically check on him while this is done. And he might feel a little bit of a sensation while it's going, and that means that the nerve endings are starting to wake up. He's going to sit here for 45 minutes, and then we're going to do 15 minutes of balancing exercises, muscles and everything used to the new change in the nerve roots. And that's all. Okay, after we do the anodyne therapy, we're going to do 8 to 15 minutes of balancing exercises. So we're going to just kind of have you sit there straight, and I'm going to challenge him a little bit, and that way he has to grab. Now, this is a more advanced therapy than I usually start out. I usually start out with a trampoline or just have them stand with their feet close together, depending on how bad the patient is. But this is probably the more middle advanced part of it. This is more of the stuff you'd see at the end of the treatment program, but you get the gist of it. So I do a little challenges here, and I'm going to have him rock it back and forth. And we have the bars here just in case he falls, and I'm always here with him the whole time. And we just do as much as we can without causing any problems.